Hello, my name is Corbin McCall, and this is the competency video for the incentive spirometer. To start off, I will verify the physician's orders and review the patient's chart. This particular patient is a 25-year-old post-op patient that has an abdominal incision. So the physician has asked us to show or instruct him how to use the incentive spirometer to make sure his airways stay nice and open. First, I will gather my equipment as well as perform proper hand hygiene and put on gloves. I will then introduce myself to the patient. Hello, my name is Corbin, and I will be your respiratory therapy student today. Can I verify your name and date of birth? Thank you. Next, I'll perform a full patient assessment that will include heart rate, respiratory rate, oxygen saturation levels. I will also look for any abnormalities in the chest wall as well as any abnormalities in the skin color. I will also auscultate his lungs and take a good listen. So once I'm done with that, I will instruct the patient how to use the incentive spirometer. Alrighty. So this is the incentive spirometer. When you are doing this, it's going to be helpful to splint your chest incision. So I'm going to ask you to hug your pillow, and that is going to allow you to not put so much strain on your chest incision when you're breathing in as well as coughing. It's also going to help maybe not make it so painful when you're doing so. But when you are doing the incentive spirometer, you're going to breathe, you're going to exhale and take a slow, steady, deep, but maximal breath through the mouthpiece here with your lips tightly on the mouthpiece. The goal is to keep this flow indicator in the better or best range. By doing so, you're going to take that steady, deep breath, and that will keep it in that range. And then on this side, you are also going, this is going to show your tidal volume here and basically how much air you inspire. The goal is to kind of establish a baseline, and then every time you do it, you are going to try to do better than that. Alrighty, let's go ahead and exhale, then take that deep breath in. Alrighty, and then you are going to do this about 10 to 15 times per session. You can take breaks in between just to kind of catch your breath. The goal is, again, to continue raising that tidal volume while you keep that flow indicator in the better or best range. And then once you do that about 10 to 15 times, if the patient hasn't coughed for me, I will ask the patient to give me a cough. So again, keeping his airways nice, clear, and open. And then again with the splint while he's coughing, that's going to hold his chest incision together and kind of prevent some of the pain caused by it. After that, I will perform another full patient assessment and then gather any trash or equipment and bring it with me. I'll perform proper hand hygiene and then record the therapy use as well as the tidal volume that he inspired in his chart, and also instruct the patient that he should hopefully be doing this every hour or two. Again, a max, or again doing it for about 10 to 15 breaths. And then hopefully by the end of the day he will continue to beat his current volume.